Hello, my name is Dr. Hannah Rosa. I'm a GP working in the northeast of England, and I also co-host the GPnotebook study groups. Welcome to the GPnotebook podcast, where we discuss bite-sized topics aimed at all those working in primary care. You can find us on all major podcast platforms, including Spotify, Apple Podcasts, and Google Podcasts. Please follow us to receive notifications about new episodes. And if you like what you hear, please consider leaving a review to help other listeners find us. You can also follow us on X at GPnotebook for more information about new podcast episodes and study groups. Finally, you can visit GPnotebook.com for podcast episode show notes and to find out more about upcoming study group meetings. In this episode, we will be discussing a topic which is at the heart of good clinical care: empathy. To start with, I'm going to tell you about the patient who inspired this episode. I'll call her Doris. Doris is a lady in her late 70s who lives alone and has a busy social life. She seems to know everything about everyone. She had an appointment to see me at the surgery, but before I called her in, I noticed that in her notes there was a letter from her recent appointment with a consultant cardiologist. I opened it up and, to be honest, I was impressed with it. It detailed Doris's symptoms, findings of a clinical examination, results from recent investigations, and a discussion of management options, which included lifestyle advice and medication changes. It was very professional and seemed very thorough. What more can you ask for? I was therefore surprised when Doris walked into my consultation room and declared that her recent hospital appointment had been a complete waste of time, that the consultant didn't listen to her at all, and that she didn't believe that any of the things that were suggested were going to make any difference. So what had gone wrong? Was it, as Doris stated, that the consultant hadn't listened to her? But from the hospital letter, it was clear that a comprehensive history had been taken. There was far more detail in it than there had been in the referral letter. So the consultant must have listened to her. What was it then that had gone wrong? What was missing? Was it that the doctor hadn't appreciated Doris's priorities and experiences? Maybe it was because her ideas, concerns and expectations, or ICE as we called it in medical school, hadn't been explored. Could it have been because Doris hadn't felt listened to or understood? All of these possible explanations could be summed up by stating that Doris felt that the doctor hadn't shown her enough empathy. This then caused me to question how much empathy I show to patients and the wider role that it plays within healthcare and within society. To start with then, let's define empathy. The Oxford English Dictionary defines empathy as the ability to understand and appreciate another person's feelings, experience, etc. Organisations such as Empathy Lab go even further and argue that empathy is our human superpower, which has the ability to change and even save the world. Psychologists Daniel Goleman and Paul Ekman identify 3 components of empathy: cognitive, emotional, and compassionate. Cognitive empathy is the ability to understand how others think about things or to see it from their perspective. Emotional empathy is the ability to care about how others feel. And lastly, compassionate empathy, otherwise known as empathic concern or empathic action, this is the desire to help others through our actions or by providing support. And it's easy to see how all 3 types work together and can help in clinical practice. I recently read a piece of research about the experiences of Malaysian patients with advanced cancer and their preferences in end-of-life care. One thing which struck me was the vast variety of ways patients wanted prognostic information to be given to them, with some patients wanting to know all the details, but others wanting bad news to be sugar-coated or given to a member of their family first so that they could act as a filter and not give them news that they believed would be overwhelming or unhelpful. Clearly, empathy is so important in this sort of situation, Cognitive empathy, the doctor taking the time to understand the individual's preferences. Emotional empathy, the desire to break the bad news in the right way. And compassionate empathy, to use our skills to communicate effectively and then to support the patient and their family through the process. So empathy and good healthcare go hand in hand. However, many studies from Europe and North America have suggested that empathy declines in students as they progress through medical school. Research has also shown that people today have less empathy compared with previous decades. A study of nearly 14,000 American college students found that over a 30-year period, empathic concern or compassion for others declined by 48%, and that perspective taking, or the ability to understand and see things from another's point of view, fell by 34%. This study, as well as others, prompted the Washington Post in 2023 to publish an article stating that we are suffering from an empathy gap. This then begs the question, why? Why as a society have we become less empathic towards others? Often technology is blamed, as we are spending ever-increasing amounts of our lives looking at screens rather than at other people, and thus becoming more socially isolated. Others blame the constant barrage of information that we are exposed to. Gone are the days of waiting for the 6 o'clock news. Now our phones constantly provide us with the latest headlines, often showing us stories of others suffering or negative predictions for our futures. This can cause us to become desensitized and create feelings of hopelessness and even anger towards others. Thinking more specifically about empathy and healthcare, why is it that empathy levels drop, especially as students progress through their clinical years? Reflecting upon my own day-to-day working life, I'd say that the biggest factor for me is time. In the back of my mind, there's a constant balancing act going on. How much time and empathy can I devote to the patient in front of me versus feeling empathy towards the other patients waiting in the waiting room, and especially if I'm running late. And then empathy towards my family and the consequences that being late home will bring. Clearly, good time management skills are essential here, whilst using empathy appropriately towards others, but also not forgetting to show ourselves some empathy. For example, by making sure that we set realistic expectations for what we can accomplish. Too much emotional empathy can also have negative consequences. We can't break down and start crying whenever someone is in a bad way. We need to be thinking clearly so that we can effectively help them. We would all also quickly burn out if at the end of every session we were carrying every patient's emotions home with us. To counter being overwhelmed by emotional empathy, we therefore need to develop ways of managing. Some of these ways can result in lowering our empathy levels, such as by being more cynical or by becoming more socially isolated. Other ways may not be healthy for us, such as turning to alcohol or other drugs. To stop this from happening, we need to instead develop healthy emotional self-management skills, such as by setting boundaries, making sure that we take appropriate breaks, and by looking after ourselves with good sleep, a balanced diet, exercise, and healthy relationships. Thinking back to research showing the drop in empathy levels as medical students progress through university and the decrease seen within wider society, you could argue that as individuals as well as collectively as healthcare staff, our empathy levels are going to be at an all-time low. But does this matter? Is this something that we need to do something about? Well, empathy has been shown to bring many benefits for our patients, our colleagues, and also for ourselves. Research has shown that empathy in clinical practice not only results in greater patient satisfaction, but it also has been shown to increase the amount of information patients disclose about their symptoms, which has then led to improved diagnostic accuracy with better clinical outcomes and lower rates of medical errors and malpractice litigation. But this is not all. Seeing an empathic doctor has also been linked with decreased levels of patient anxiety, patients reporting less pain, a decrease in length of hospital stay, diabetic patients with better HbA1c and cholesterol control, and even the common cold lasting for fewer days and being less severe, with changes in interleukin-8 and neutrophil levels being observed. The cherry on the cake, though, is that health professionals with higher empathy scores are also believed to have greater job satisfaction. The next step, then, is to see if there are ways of increasing our empathy. Research all tends to agree that empathy is a skill that can be developed. Studies in medical schools have tended to show that experiential approaches, such as role play, can increase empathy levels for the students and for the doctors facilitating the sessions. Videotaping patient encounters, having exposure to positive role models, and practicing the Ballant method have also all been suggested. Thinking back to teaching on communication skills that I've had throughout my training, a lot of these were aimed at trying to increase empathy within a consultation. As well as asking patients about their ideas, concerns and expectations, I remember being taught skills such as not to interrupt the patient when they're making their opening statements, and to start with open rather than closed questions, to try to pick up on verbal and non-verbal cues, and to maintain an appropriate level of eye contact, trying to avoid looking at the computer screen too much. Why not take a few moments to reflect upon these communication skills and others that you will have developed and picked up over the years? And when you're next at work, reflect upon which skills you have fine-tuned over the years and which have disappeared, maybe should make a comeback. My favourite exercise in increasing empathy, though, is one that everyone can do. First, think of something that really annoys you. For example, for myself, it's when someone pushes in front of me in a queue. Next time, think of a justification for this behaviour or a positive trait that the person may have. For example, when someone pushes in front of me in a queue, it might be because they're needing to get home for a sick relative. Next time someone pushes in front of me, I'll try not to let it annoy me, but instead use it as an opportunity to increase my empathy by thinking about why that person may be in a rush. This same exercise can be adapted for clinical practice too. Think back to a difficult patient interaction that you've had, and using empathy, try to think of some reasons why it may have happened. When I was a trainee, I remember seeing a lady about her acne, and from the start she was quite aggressive in her tone, repeatedly asking me why I was asking her so many questions when it was all in her notes. When she left the room, she then complained to reception that I hadn't asked her enough about certain things. Afterwards, I remember feeling a bit shaken and confused. This same lady made an appointment to see me again a month later, and this time it was to discuss her mental health, as she was really struggling following an ongoing difficult divorce. I often reflect upon this case as a reminder that you can never know everything that's going on in a person's life. So, back to Doris. I was surprised by her comment that she hadn't felt listened to, and it would have been easy to have dusted this off and labelled Doris as a difficult character. However, I asked her to expand on what she meant. Now, Doris is a retired scientist and used to research the effects different nutrients in food have on our bodies. She therefore felt quite patronised to be told that she needed to eat 5 fruit and veg a day, oily fish and whole grains, as this is what she's been doing for the last 50 years. She explained that what she'd really wanted to know, the question that was keeping her up at night with worry, was how long, based on his experience, a person with her cardiac condition at her age had left to live. She wanted to know how much time she had to get her affairs in order. However, when she broached this issue, she felt that her questions were quickly brushed off. When we use a little bit of empathy and see the clinic appointment through Doris's eyes, we can begin to understand why she hadn't felt listened to. As a final thought, I'll share with you a quote from Dr. Jane Goodall. Empathy is really important. Only when our clever brain and our human heart work together in harmony can we achieve our full potential. Thank you all for listening. We hope that you found this podcast helpful. Please do have a look at the show notes that accompany this episode at GPnotebook.com. And we'd be very grateful if you would consider following the podcast and leaving us a review on your favourite podcast platform. Feel free to get in touch via social media at GPnotebook or email support@gpnotebook.com if you have any questions, comments or ideas for future podcasts. You should also visit us at GPnotebook.com to register for our virtual GP Notebook study groups and download free shortcuts to help improve the lives of our patients in primary care. Right, I'm off to find Doris and ask if she'd like to join me in saving the world with our empathy superpowers. Bye.